Welcome to LexCura Clinical Insights, the podcast where clinical evidence, healthcare standards, and litigation strategy come together. I'm Michelle Carroll, founder and chief clinical strategist of LexCura Summit. Falls in home health are among the most common and often the most preventable adverse events affecting patients receiving care at home. The OASIS assessment requires clinicians to evaluate fall risk, functional limitations, and environmental safety at the start of care and again at recertification. When a patient falls and the record already identifies a high level of risk, but no meaningful intervention appears in the plan of care, the breach may be visible in the chart. The same is true when environmental hazards were never properly assessed, documented, or addressed. In this episode, I will explain how to read the OASIS fall risk findings, compare them with the care plan, and visit documentation, and build the liability analysis from assessment through injury. Okay, so here's a thought. Falls in home healthcare might just be the most misunderstood liability issue in healthcare litigation. It's not about bed alarms or hourly rounding. It's about something entirely different.
That's already surprising. Most people probably assume a fall is a fall, right? What makes home health care so unique in this context?
Well, it all comes down to the framework. In institutional settings like hospitals or nursing homes, you've got systems in place. Staff on site, monitoring tools, protocols like the Morse fall scale. But in home health, the standards are completely different. The key tool here is OASIS, the Outcome and Assessment Information Set, and it's federally mandated for every Medicare-certified home health agency.
So OASIS is like the rulebook for home health care. What does it actually do?
It's more than a rulebook. It's a clinical assessment tool that captures everything from a patient's functional status to their cognitive abilities, pain levels, and most importantly, their fall risk. But here's the kicker. It doesn't just identify risks. It creates obligations. If a patient's OASIS profile flags them as high risk for falls, the agency is required to develop a care plan that addresses those risks specifically and comprehensively.
That's a big deal. So if the agency doesn't follow through on those obligations, that's where liability comes into play.
Exactly. And this is where attorneys often get tripped up. They approach home health fall cases using the same standards they'd use for a hospital or nursing home case, but those standards don't apply here. In home health, it's all about whether the agency met its obligations under the OASIS framework and the CMS conditions of participation.
And what happens if they don't? What does that look like in practice?
Let's say the OASIS assessment identifies a patient as high risk for falls due to balance issues and a history of previous falls. The agency is then obligated to create a care plan that addresses those specific risks. If the care plan just says something generic like instruct on fall prevention without detailing specific interventions, that's a problem. And if the patient falls, that inadequate care plan becomes a key piece of evidence in a liability case.
That's such a critical point. It's not just about identifying the risk. It's about how the agency responds to it. And if the response is inadequate, it's almost like they're setting the patient up for failure.
Exactly. And it's not just the care plan. The environmental safety assessment is another area where agencies often fall short. This is a required part of the initial evaluation, and it's supposed to identify hazards in the patient's home, things like loose rugs, poor lighting, or the absence of grab bars in the bathroom.
So, if the agency doesn't conduct that assessment, or if they identify a hazard but don't address it, that's another potential liability issue.
Absolutely. And it's not just about identifying the hazard, it's about documenting what was done to address it. Did they educate the patient and caregiver? Did they recommend modifications or equipment? If those steps aren't documented, and the patient falls in a scenario that matches the identified hazard, the agency is in a tough spot.
That makes so much sense. And it's interesting how the documentation, or lack of it, can tell the whole story. It's almost like a breadcrumb trail, leading back to the root cause of the fall.
Exactly. And that breadcrumb trail becomes even more important when you consider the reassessment obligation. OASIS isn't a one-and-done document. Agencies are required to update it whenever there's a significant change in the patient's condition, like a new medication, a recent hospitalization, or even a reported near fall.
So if they don't update the OASIS after a significant change, that's another breach of standard care.
Exactly. And it's a common issue. A nurse might document something like, patient reports dizziness when standing. But if there's no follow-up, no physician notification, no care plan update, that's a red flag. And if the patient falls after that, the failure to act on the documented change becomes a key liability issue.
It's almost like a domino effect. One failure leads to another, and before you know it, the system has completely failed the patient.
That's exactly what happens. And it's why understanding the home health framework is so critical for attorneys handling these cases. If you don't know what to look for, if you don't understand the obligations created by OASIS and the CMS standards, you're at a huge disadvantage.
And that brings us to the care plan itself. What does an adequate care plan actually look like in the home health setting?
Great question. An adequate care plan should be specific and individualized. It should address the specific fall risk factors identified in the OASIS, things like a history of prior falls, gait instability, or cognitive impairment. It should include concrete interventions for each risk factor, a detailed education plan for the patient and caregiver, and a monitoring schedule that matches the patient's risk level.
And if the care plan doesn't include those elements, that's where the breach argument comes in.
Exactly. A care plan that just says instruct on fall prevention without specifying what that instruction entails or how it addresses the patient's specific risks. It's almost worse than having no plan at all. It shows that the agency was aware of the risk but didn't take meaningful action to mitigate it.
That's such a powerful point, and it really underscores the importance of the regulatory framework. Home health care isn't a free-for-all. It's governed by specific standards and requirements. And when agencies fail to meet those standards, the consequences can be devastating.
Absolutely. And that's why Michelle Carroll's 5 takeaways are so valuable. First, always analyze the OASIS in full. It's not just about the full specific items, but the entire clinical picture. Second, request the environmental safety assessment specifically. Third, map the clinical trajectory from start of care to the fall event. Fourth, compare the OASIS profile to the care plan interventions. And fifth, anchor every argument in the home health regulatory framework.
Those takeaways are invaluable, not just for attorneys, but for anyone involved in home health care. They're a roadmap for understanding where things went wrong and how to build a case or a defense based on the actual standards of care.
And that's what makes this topic so fascinating. It's not just about the clinical side or the legal side, it's about the intersection of the two. Understanding that intersection is what makes the difference between a case that's dismissed and one that leads to meaningful accountability.
Couldn't agree more. It's a complex topic, but one that's incredibly important. And I think Michelle Carroll did an excellent job breaking it down in a way that's both accessible and actionable.
She really did. It's a masterclass in clinical intelligence for healthcare litigation. And honestly, it's a conversation that needs to happen more often. These standards exist for a reason, and the more we understand them, the better equipped we are to hold the system accountable.
Well said. And on that note, I think we've covered a lot of ground today. Any final thoughts?
Just that this is a topic that's not going away anytime soon. As the population ages and more people rely on home health care, these issues are only going to become more prevalent. So, understanding the framework now is more important than ever.
Agreed. And I think that's a great place to wrap up. Thanks for diving into this with me. It's been a really enlightening conversation.
Likewise, always a pleasure. Let's do it again soon. Thank you for listening to Lex Cura Clinical Insights. In a home health fall case, the analysis does not begin with the fall itself. It begins with what the agency knew, or should have known, about the patient's risk before the event occurred. The OASIS assessment, functional findings, medication profile, prior fall history, environmental evaluation, physician orders, care plan interventions, and visit notes must all be read together. When the record identifies the risk but the plan fails to respond to it, the chart may establish both notice and breach. The next step is to connect that failure to the circumstances of the fall, the resulting injury, and the harm that followed. For more clinical intelligence, litigation analysis, and practical guidance, visit Lex Cura Summit at lexcurasummit.com. I'm Michelle Carroll. Thank you for joining me, and I'll see you in the next episode of Lex Cura Clinical Insights.